It's actually pretty easy to get it to come back if we just do the right movements. The last potential direction that it may go is posterior. This is definitely much less common, although it certainly can happen. And the most common situation that I would see it happen is if, let's say, you were doing something very strong in this position and you didn't have good control over your shoulder yet and things actually subluxed too far posterior, right? Or if you were pushing something really heavy, you had to push open a really heavy door, you had to do something where the shoulder goes posterior, you fall onto your hand, that type of thing. So in order to get it to go back anterior, what we can do is, leaning forward, we can do what's called a pendulum type exercise or a Codman's exercise. And you can hold on to something like a chair or the back of a couch, but essentially we just want your arm to come forward and we can just let it relax down. And then try a little bit of movement of your body, swaying side to side, back and forth. And for this, I do actually, if you're going to be there for a moment, if you have a sense that that might help, you do want to hold on to something just to save your back. So a nice tall chair works really well. So the idea isn't to really use my arm muscles. You just let it actually totally relax. My body is moving. My legs can sway side to side. My legs can move my body forward and back a little bit, but I'm keeping that arm really relaxed to let gravity do the work to bring it forward. And you'll notice, again, this is working because it feels like it'll feel like it's helpful. Feel like you might feel a click or a pop into place or a sudden sense of relief, like, oh, now this is where I need to be. Now, the other thing that we can do for a shoulder that is potentially posteriorly subluxed is use the muscles on the front of the shoulder joint to help encourage it to glide anteriorly. So to get it to glide anterior, two things. One is using your other hand to apply resistance. We can in a sitting position, or you can do this laying down. So what I'm going to do is use my hand against my wrist and then do a little bit of a contraction of the front rotator cuff muscle by pressing inward. So my hand presses against my wrist like this, and my left hand is pushing inward against my other hand. It doesn't look like I'm doing much, so I'm just putting a little bit of pressure of my hand. I'm attempting to do this motion, hand in toward my belly. My other hand is giving some resistance. Hold about 5 to 10 seconds and do that at least 5 or 10 rounds, and then retest your painful movement. If that did not help and your shoulder is actually subluxed in another direction, be sure to check out my other videos that show what to do to help self-adjust a shoulder that's either anterior or inferior. So be sure to check those out, and thanks for watching.